Is skin picking genetic? Have you ever wondered if skin picking is something that runs in families? This behavior, known clinically as excoriation disorder, involves repetitive and compulsive picking at the skin, often leading to noticeable damage. When we think about whether skin picking is genetic, it is important to know that genetics can play a role, but it is not the only factor involved. Research shows that skin picking disorder can run in families. This suggests that there may be a genetic component at play. Some individuals might inherit a tendency toward this behavior due to genetic influences on how the brain works and how neurotransmitters are regulated. For instance, imbalances in serotonin and dopamine, which are chemicals that affect mood and impulse control, can be influenced by genetics and may contribute to skin picking behaviors. However, skin picking is a complex behavior with many factors beyond just genetics. Neurological differences, environmental influences, psychological distress, and co-occurring mental health conditions like anxiety, obsessive-compulsive disorder, depression, and autism spectrum disorder are all important pieces of the puzzle. In the context of autism, skin picking is often viewed as a form of repetitive behavior or a way to manage sensory input. Many autistic individuals may engage in skin picking to cope with overwhelming emotions, such as anxiety, or to provide sensory stimulation when feeling bored or stressed. This behavior can happen without conscious awareness, making it hard to control. For autistic individuals, skin picking may be part of a broader range of repetitive behaviors, sometimes referred to as stimming. These behaviors help regulate sensory input and emotional states. Other examples of stimming include head banging, hair pulling, nail biting, or hand flapping. The presence of skin picking in autism may also be influenced by co-occurring conditions like anxiety or obsessive-compulsive disorder, which are often found in autistic individuals. Since skin picking in autism often serves a self-regulatory purpose, simply trying to stop the behavior without addressing the underlying sensory or emotional needs is usually not effective. Managing skin picking typically requires a well-rounded approach that considers the full clinical picture, including autism symptoms and any co-occurring disorders. Some practical strategies for managing skin picking in autistic individuals include identifying and addressing sensory needs through occupational therapy, using behavioral interventions tailored to individual triggers, and providing emotional support. It is also important to coordinate care among specialists to address any co-occurring conditions and ensure a supportive environment that reduces stress and sensory overload. In summary, while skin picking has a genetic component, it is influenced by a mix of neurological, psychological, and environmental factors. In autism, it is often linked to sensory regulation and emotional coping strategies. Understanding these multiple influences is key to effectively managing this behavior.